Hello friends, welcome to OET Wings. Today we are going to discuss a complete writing task in this video. I will give the case note in the description and also I will give some of the video links that will help you in your writing task. So let's move to the writing task. As we all know, we have 45 minutes to complete the writing task, in which reading time is 5 minutes and writing time is 40 minutes. But my suggestion is to read or take 5 more minutes to read and understand the case note. That will help you to understand the task and the letter so you can manage the writing task easily. So in this letter, a case note is about Mr. Johnson is a 68-year-old patient on the ward of a hospital where you are a charge nurse. Mr. Johnson is our patient and he is 68 years old and you are the charge nurse of that particular ward. After this, we skip through all other details given and will go to the writing task so we know whom we are going to write the letter and which type of letter is this. Is this a referral letter or is it going to be a home visit letter? So we understand what type of letter we are going to write. So take a minute completely and understand the writing task. Here, using the information, write a letter to Miss Melissa Holt, Senior Community Health Nurse, for Mr. Johnson's continued care at house number 3, Melwick Road, London. Here it is clearly mentioned that Mr. Johnson's continued care at house number 3. That means this letter is to request home visit. After understanding the writing task, it is always a good idea to read discharge summary where we get all the information about what we are going to request in this letter. So here the discharge summary is monitor medication, preserve skin integrity, dressing every third day, continue exercise, physio arranged for home, wheelie walker, wedge pillow, toilet razor arranged from hospital. Now, the most important part is to find why Mr. Johnson is under our care or the reason for admission. Here it is given the reason for admission as an elective total knee replacement, difficulty mobilizing and worsening of osteoarthritis. That's the reason for admission. So with this time we understood what the patient name, his age, what type of letter is this and what are the requests we are going to ask in this letter and the reason for the admission of Mr. Johnson. Now we know all the vital parts of this case note and we will read the case note from top to bottom for our complete understanding of the letter. Let's read the case note together. Mr. Johnson is a 68-year-old patient on the ward of a hospital where you are a charge nurse. Patient details: marital status married, job retired, lives with wife, 2 daughters abroad, admission date 20th March 2023, discharge date today. Reason for admission: an elective total knee replacement, difficulty mobilizing and worsening of osteoarthritis. Medical background: diabetes 2012 and hypertension 2016, Metformin and Amlodipine. Nursing management: daily dressing, surgical incision site, range of motion, stretching exercise, FBE and UEC alternative days, physio and occupational therapy, pain relief as required. Assessment: good mobility, good prognosis, weight bearing with use of wheelie walker, continued observation, dropped HB postoperatively, requiring 3 units packed red cells, now stable, 140 gram per dl. Postoperative disorientation during recovery, possibly related with anesthesia. Discharge summary: monitor medication, preserve skin integrity, dressing every third day, continue exercise, physio arranged for home, wheelie walker, wedge pillow, toilet razor arranged from hospital. Writing task: using the information, write a letter to Miss Melissa Holt, Senior Community Health Nurse, for Mr. Johnson's continued care at house number 3, Melwick Road, London. So it took almost 6 minutes to read and understand the case note, even while I was explaining you the things around. So it was a small letter, or the case note was not detailed very much, so we could finish it in 6 minutes. So in other letters or the case notes, we could take maximum of 10 minutes to understand the case note. So why I said take 5 more minutes to understand the case note, which will be very easy, and you can arrange your letter in your comfort level, and you won't miss any related points to this letter. So while reading this letter, we understood our patient name is Johnson. He is 68 years old and he is under our care for an elective total knee replacement. He got diabetes and hypertension. He is married, he is retired, he lives with his wife. His 2 daughters are abroad. So we got all this information and what the treatment given in the hospital and what the assessment is now. And we know the discharge summary, monitor the medications, preserve the skin integrity. And we know whom we are writing this letter. We are writing this letter to Melissa Holt, who is a senior senior community health nurse. And this is going to be a home visit letter. We are requesting Miss Melissa to visit Johnson's home and continue his treatment. So with this 6 minutes, we understood complete letter, and now we are going to write the letter. So it is a good idea, always take 5 more minutes, extra 5 minutes to read and understand. So if you understand the letter and if you read it carefully, it is going to be very easy to complete your writing task, and it is not going to take more than 20 minutes or maximum of 25 minutes to complete the letter. So you complete the letter in 25 minutes, you write the letter in 25 minutes, you took 10 minutes to read the letter, so that's going to be total of 35 minutes. Then you got another 10 minutes to read the letter you have written again and again to find any mistake, like spelling mistake or any sentence structure, or you will get time to read it carefully, or you can again read it and you can find if you miss any of the points which needed to be in the letter. So we will now going to see how we are going to write this letter. I am writing to request home visits for Mr. Johnson, who underwent a total knee replacement surgery. He requires care and management from your facility. So you might be thinking why I did write home visits, because in the discharge summary it was given as he needs dressing every third day, so he requires home visits. Write your own way of introduction for this letter and comment under this video so we can go through it, and maybe if you require any explanation I can give you after. In the second paragraph, Mr. Johnson is retired and lives with his wife. He is diagnosed with diabetes and hypertension in 2012 and 2016 respectively, for which he is on Metformin and Amlodipine. Please note that he is non-compliant with his medication. Did you notice that non-compliant, which was given with the Metformin and Amlodipine, after that in a bracket non-compliant? So we have to add that as well, because this patient is non-compliant with his medication. He don't take his medication correctly. In our third paragraph, On 20th March 2023, he has undergone an elective total knee replacement surgery due to worsening of his osteoarthritis. So that's the reason, because of his osteoarthritis, he was having reduced mobility and he underwent an elective total knee replacement. I did not write he underwent because we already used that in the introduction. So I have written as it he has undergone the surgery. The next paragraph is about his stay in the hospital. So during his stay in the hospital, he has been treated with his regular medications and pain relief as prescribed. He also commenced physiotherapy, which will be continued at home for 3 months. He is now ready to be discharged. Have you noticed that the physio will be continued at home for 3 months, which was given in the discharge summary, physio 3 months. Now in this paragraph, we will write what's our requirement or what the request we are going to write in this letter. It would be greatly appreciated if you could continue his treatment at home. It is vital that he takes his medications promptly. His dressing needs to be changed every 3 days to preserve his skin integrity. A wheelie walker, wedge and toilet racer are already being arranged from our hospital. So he is already a non-compliant patient with the medication, so we need to regularly check that he is taking his medications promptly. Also, I could have written wedge pillow. Instead, I did write wedge. That's a mistake. So how to write wedge pillow incomplete. A wheelie walker, wedge pillow and toilet racer are already being arranged from our hospital. It's a home visit letter. We are requesting home visits. So we have to write the address of the person who they have to visit. So here I have written as Mr. Johnson's address is enclosed with this letter. I am sure that your role is pivotal in his better recovery. You could add his full address like how it is given in this, in the case note. Mr. Johnson's address is whatever it is given as it is in the letter. And I have added the next sentence. I am sure that your role is pivotal in his better recovery, because I want to make sure I write 180 to 200 words in my letter. And what I think is this letter content is very short, so I won't be able to write complete 180 words. So I just added that sentence as an extra sentence to make sure I will have 180 to 200 words at the end. Now we have completed almost our letter and we will add our salutation sentence. If you have any queries, please do not hesitate to contact me. Thank you for listening to me. I hope this video will help you in your writing task. Check the description for more links related to writing task. Comment how you are going to write the introduction or a sample letter, how you are going to write for the same question. And also leave your comments in the comment section. Hope you have a good day. Practice well. All the best. Thank you.